Okay, today I'm talking with Alliric Willis, who is at Jefferson University, just across town from where I'm sitting right now. And he is the chair of the DEI advisory board of the SSO. Welcome, Dr. Willis.
Great. Thanks for having me. Really appreciate the time.
So can you tell us a little bit about the priorities for the advisory board this year?
Sure, my pleasure. The priorities for the advisory board are really focused upon developing projects and programs that support the SSO's strategic plan in diversifying the surgical oncology workforce, as well as diversifying the membership of the SSO and increasing inclusion across all aspects of the society.
Can you mention what the Foster the Future program is? I got an email last night that said somewhere around 150 people applied for it.
Certainly. We started this for the first time this year. We really planted the seed out there and have been pleasantly surprised with 152 completed applications, CVs, essay questions submitted after just having this open for about 6 weeks. So that really lets us know that the interest is there, that people desire to go into surgical oncology, and all they really needed was the opportunity. As everyone I'm sure is aware of, we have underrepresentation of minority groups within medicine, and this is also seen within surgical oncology. The SSO has made a conscious effort to increase diversity within the surgical oncology workforce, understanding that that will bring about the best care, optimal care for all patients across the country and around the world. And a critical element of this is the pipeline, increasing the number of, or in the diversity within the surgical oncology workforce that is developing.
The seed turned into a tree in a very short period of time. Very impressive. So lastly, can you tell us about some of the goals that the advisory board has for the future?
A couple of areas that we've addressed are podcast series. So we have many in other organizations, you may hear of affinity groups and the like, but what we've actually done is we've had podcasts for different groups to discuss surgical oncology and how that might affect them. For Asian American Heritage Month, we had an outstanding podcast on that. We have had podcasts, an excellent one involving for Hispanic Heritage Month, where we reached out to the equivalent societies of surgical oncology in Mexico, and they engaged with us. And we had a podcast, or actually a Zoom webinar for that, larger one, where we had excellent input. And we're talking about global entities. We've also engaged with other organizations outside and participated in sessions on clinical trials, increasing diversity within clinical trials. So what we're doing is increasing inclusion and diversity within the SSO, but also expanding our footprint outside of the SSO and engaging with partners so that we can be even more impactful around the country and the world.
Well, there's no question you and your group have done a great job already, and there's much more to come. So thanks, Dr. Willis, for telling us a little bit about the advisory board this afternoon. Keep up the great work.
Thank you. I appreciate it.